Hello, I'm Dr. Shruti. I'm a physical therapist from Height Increase Info. So we have another successful story of tibial lengthening. Let's know about his journey, his experience with Height Increase Info.
Hello, I am a doctor from Sri Lanka. I came in the end of January this year, do the surgery to increase my height. My initial height was 160 centimeter and I managed to lengthen up to 6.2 centimeter. Currently my height is 166.2 centimeter. I am very satisfied with the gain which I was got currently. Yes.
Okay, so why you choose this Height Increase Info and how long you been searching for this height increase surgery?
Yeah, actually I was searching, I just want to do the surgery I was having since like 18 or 19 years, but actually I started to search about this very seriously 4 years back. I wanted to do, I think, during the corona time in 2020, early 2020s, but at the time I was having some financial issues and I didn't get a proper guidance at the time, and I couldn't find a good the institution where I can go undergo the surgery. And wherever I search, I could either it is out of India or it's somewhere it's not like either the surgery only there is no physiotherapy. The combination package which I could find it from the Height Increase Info. So I choose this one.
Because everybody is not providing that surgery and plus rehab.
Post rehabilitation services that's the main reason which I choose this one. And I have gone through with many of the videos in the YouTubes what they have provided, and also I had an idea like I had to go a surgery, but I couldn't had the direct consultation. I did the online consultation with the Dr. Harrison. So he explained me everything, what are the packages and what are the like accommodation and post-op surgery, the type of surgery, what are the nails they are going to use it, and how much the 1 mm per day in the initial stages, followed by the post-op care for 5 days to stay in the hospital, and followed by starting the lengthening, and followed up the x-rays, followed up with an x-rays and also the physiotherapy.
Supplements and all.
Yeah.
They told you in the time of consultation.
Yeah, they have explained me what are the supplements I supposed to take, and also I also had many doubts. I got cleared with him like regarding the what are the other supplements other than the supplements like proteins like whey proteins and also collagens which I taken from the outside that also would helpful for my speed recovery.
In the pin cutting time, it helps to increase your skin elasticity.
Yeah, supplements is very helpful. Yeah, it's like and also other supplements which are like, because some supplements we cannot be get from the diet but we are getting so that should be so whenever we are in the recovery process we should have a good nutrition support during the processing, so that's what can be covered either by the diet and also the recovery, and also the stretching and strengthening exercises also help me a lot.
Okay, so as an international, how you prepare yourself, because you have to choose a different country for the surgery. So how you prepare your mind to go to the another country for the big surgery?
Yeah, it's like quite challenging decision which I had taken, because there are many countries are offering this surgeries but it's like it was there for a long time, but recently it becomes more evolving, like most of the institution has started on that, so I had to research on that to find a good institution where I can go and do the surgery. And also the India is like, I am from Sri Lanka, so it's nearby country, and also I have visited like around 10-12 years back I was in Delhi as well, so at the time so I am more comfortable to coming here to do the surgery.
Okay. Yeah. So how's your experience when you are in frames?
Yeah, my frame period, it's not that much difficult, which I felt. By my initial frame period was nice because I didn't feel much pain on that. But in the later periods, because my target was around 8 centimeter, which I was aimed earlier, because some complication might arise, like I got some inversion of my foot. So the physiotherapists I have consulted with physiotherapists and doctors also advised me can go up to 6 or 6.2, then I have planned to stop by that time.
That's why it depends on the patient's condition.
Yeah.
How much you lengthen during frames. It's more important.
Yes.
So you choose height increase info. In India, there is so many centers who providing this surgery in a cheaper price.
Yeah.
Now, what is your suggestion? What you suggest to another peoples who want to go for this surgery?
I would say that rather than going for the cheap surgeries, because you are going to invest your life on this, right? If any complication occurs, if cannot be corrected, the money what you invested, that will be going in vain, and also your life also, the rest of the life you may have to suffer because of that. So better to research better, like you have to go through with the patient's experiences, who has already gone through with this journey, and also if you can get a chance, talk with the patients, like get contact with the patients who has done the surgery, and talk with any other research, analyze with the other institution and compare with the things, and how much is the successful rate. That will make it that you can choose it better. So that would be make it better, and also you can get a faster recovery, and also you can go back to your normal life what you are aiming for.
Okay, so as you say, you are a doctor. So how many things in your mind when you prepare for this surgery? Because this is a very big surgery. So how you prepare your mind as a doctor?
Yeah, I understand what you are coming to ask. The thing is, if I was like, there are many people would have seen this video. Okay, many people would the different specialities. Even I have met several roommates. They are software engineers, and some others from the on-site business, and some are from students who wants to go for a universities. Like different categories. For from my point of view, what I can say, I am being a doctor, I got aware of this, like that also in a later stage. But if I was not in a doctor, I would have worried more about these things, because I had done many surgery, I have assisted many cesarean sections and also other surgeries. So I just made up my mind, whatever it is, okay, even though we are risking our life, we have to get better future. Like just you are suffering for these 5 months, you can get like another 30 or 40 years or more than that, you will feel better of your life. Because if you don't go for this surgery, what will happen, it will be in your mind only, like I would have done this, I would have done this, why didn't I do this? Even you settled and everything, even you are getting all the respect and everything, your inferior complexity would be there, that cannot be cured by anything else. That's what I felt from my side.
It's all about confidence.
Confidence, yeah.
Okay. So how you prepare, like what you did before surgery, like for flexibility, for your nutrition, what things you are focusing? What is the main target? What is the main thing you have to do before the surgery? How you prepare yourself for the surgery?
Yeah, you have to prepare your surgery better. It's from your mentally also you have to prepare, physically also you have to prepare. Mentally, you have to get prepared to go for this surgery first. It's not like one time you are going for surgery, one time for the first time nail insertion and frame insertion, and second time maybe after 2 or 3 months you may have to go for the frame removal. In the case of one surgery, if it in the case of like cross lengthening patient, they may have to go 4 times. Like they have to prepare their mind more than us. Like for us, for me, I went through the tibial lengthening surgery. So I feel it was better, like comparatively, like femur and tibia, I feel better. It can go through with that thing. And the physically, if you can manage to keep your BMI, like body mass index, like around within 25, like mine is like I was around 65 kgs when I was coming here. Now I just measured, it was around 60 kgs. So it's like with my 166, it's around 21. So if you could keep in between 20 to 25, so that would be better, like your recovery would be faster.
So flexibility is also major part of this surgery. So now finally you are going back to your own country. Are you excited?
Yeah, it's like excited and little bit nervous also, because I was here for almost around 5 months. Like I'm going back to my family after 6 months of time. So they also more excited.
to meet you.
Even it's very difficult to made up their minds. Even if you come to your mind, you have to made up their mind to satisfy them. Like even if you are saying you are going for a surgery, they definitely like they will reject, like they will object about that thing, because any parents, they don't want their child to suffer because of this height. They are more happy about this thing, but at their point of view. But like us, like if any of us are going for the surgery, their mind only, they will know how much they are suffering because of in the social inferiorities, and when they are going with the queues and when they are talking with the friends, how do they feel, and that matters also.
Right. How's your recovery going on?
Yeah, recovery so far so good. I could feel it. Right, earlier I was having some issues like the callus formation, like left side and right side. When comparatively left side, I was having some little callus formation, but the right side was pretty well from the beginning of the journey. So when I was going for a frame removal at the time, doctor has identified that there was a cyst formation, that is like fluid-full cavity. It has occupied in that area cavity. So he has suck out that place and did some bone marrow injection that really helped me to regain my callus in that empty place which I had increased so far. So with that, I also taking the PTH injection that really helps me to boost my bone callus formation and mineralization. So the recent X-ray also was pretty well. So currently I can use like 2 crutches, and also I try to walk with 1 crutches, but doctors are advising for go for another 2 to 3 weeks for 2 crutches. Then with the next X-ray, I could shift to the independent walks. Hopefully I am waiting for that.
Your recovery was pretty good.
Yeah, I hopefully get it.
You can walk with the treadmill and normally walk.
Yeah.
You use the stairs also.
Yeah.
Stair climbing.
Yeah, stair climbing I use with crutches currently. I try to walk with the support of rail, and also without the support of rail with 2 crutches also. And it was pretty good. Like I was earlier a bit afraid of going down about because of the height. Like suddenly we are looking like this, and after so much surgery and those things. But after 2 or 3 days of training, I could able to walk with the stairs.
Okay, so this is his final interview. Now he is going back to his own country. If you have any query about limb lengthening or limb reconstruction, you can contact our channel. Thank you.